Oh, thanks, sorry. Good evening, everyone. Thank you so very much for your patience. It's 6:44. I'm calling the meeting to order. And sometimes we are a little bit after 6:30, but I was waiting for our quorum. And so we have it. There are 5 members of the committee. And we have one, Clotilde, who is virtual. And we have 3 of us who are here. So we can start because we need the committee here to hear and know what's going on, offer their opinions, suggestions, vote, whatever is needed. They're important to the process here. So again, thank you very much for your presence. What I am going to do now is ask to have the agenda adopted. There are a couple of things that, at least one thing I want to add in particular, adding the discussion of the sickle cell concept that we actually devised and didn't make the public forum, but add that to new business to discuss among the committee members. So we'll add that in under new business. I also want to add to announcements, Yana, Dr. Ronstrom's program, her that she didn't get. I think she emailed it, but there was a second email or flyer she wanted to do. So if we would add that to the announcements, that is the COTA Alliance. Are there any other additions or changes for the agenda? Okay, so I need one of us here present to move to adopt the agenda. Okay, Heather has moved to adopt the agenda. It has been seconded by Liz Eastman, and we are all in favor of that. In terms of minutes, I have been missing our warrior minutes taker for months. Our February, March, and April minutes have will be produced for approval, seconded, mailed out to our committee members, and you know, before the June meeting. You see how that is a huge task. So I was able to do it through the last 3 with the help of Edwin. And we got it done, you know, but it was 3 minutes and it's just a lot. Okay, so I guess we need a motion to just table adopting the minutes as they're not ready for us. Heather, can you?
Go ahead. Oh, sorry.
Just table the adoption of the minutes.
That's fine. Motion to table.
Okay, and that's been moved by Heather Jason and adopted by Liz Eastman. And so thank you very much for that. So under announcements, Yana, Dr. Ronstrom, are you where? For some reason I can't see the faces big. Up
Yes,
there.
I'm here. Thank you.
Okay. Hi there.
Hi. Thank you so much for having me.
Yes, and will you make your announcement?
Yeah, I can make it really quickly now. So May, you know, is Mother's Day, of course, next weekend, and the following weekend we're celebrating new moms with a community lunch. So we have like 6 signups right now, but we can take 20. So if you know any new moms. It's intended to be for peer support essentially. So it's just like a nice lunch catered by Deandra Sital, who's a local caterer. You know, the mothers will have a lot to share. So it's, you know, for resources and peer support.
So
and-
you're asking, so
Sorry.
you're asking for new moms? You
Yeah.
want luncheon for new moms?
That's right. So they can come with their babies, obviously. And if they have older children, we can take some of those too, you know, if they're not exactly new moms, but, you know, have a little baby and are experiencing pregnancy, you know, have just experienced pregnancy all over again. So they're welcome. And if anybody wants a flyer, I'll put my email in the chat. You can just email me and I can forward the flyer. But it's also on social media and on our website.
And your social media, Dr. Armstrong, is which?
Well, it depends. Like we have Facebook and Instagram, and I think it's Coda-Alliance for both of them. It should come up if you just search for Coda. Or if you have a tag for your own, if you want us to tag you, like I'm not quite sure who else is here, but if you represent an organization and want us to tag your organization so you can easily share it, you could put that in the chat and I can take it down.
We have right now what I can see, and let me go to my computer. Let's see, we have 13 persons in watching virtual. Okay, and actually that includes Heather, so that includes me too. So let's see here, 1, 2, 3, 4, 5, 6, 7, 8, 10. It's about 10 roughly, maybe a couple more than 10 as I look at this. Yeah, people are coming on now. So we have more, and then there are 3 here. So you know, somewhere between 15 and 20, probably before this is all over. So it would be great. Thank you for putting it in the chat. And I guess the location you will give, you'll email that once you hear from the person, or how will that?
Oh, no, it's at Coda. Yeah, it's at 43 St. Nicholas Place. I'll
Which
put the
is
address here as well.
roughly what, 100 and
152nd Street.
okay. And then Heather, if you could help me also looking at if there's anything that comes up in the chat that I should be made aware of, that would be absolutely super.
Okay.
Okay, thank you so much. Help with all the multitasking. Okay, someone else has
Hi, yeah, this is Antonika.
Hi, Tanika.
Hi, how are you?
I'm good, thank you.
Good, good. I think I missed the date and time of this event so that we can pass it along to some of the.
Yes, thank you. May 18th
Okay.
at 2 p.m.
Okay, thank you.
What day of the week is the May 18th?
It's Saturday.
It's a Saturday. And it's a luncheon, Antonika, just in case anyone did miss that
Got
part.
it. Okay, thank you.
Do we, thank you so much, Dr. Armstrong. Is there anyone else who has a particular announcement they'd like to make? Okay. Moving along, I'm not sure if Pauline from Department of Health and Mental Health is here. She's the Manhattan Community Liaison for in the Office of External Affairs for Department of Health, Mental Health. Let me just see if is there anyone else here from DOH?
Yes, hi, good evening, Laquita. Good evening, everyone. This is Darren Hoke.
Yes, but we're gonna call on you special since you're a special presenter.
Okay. Well, I'm also from the Department of Health and Mental Hygiene, so.
Okay, and hopefully we'll get to actually see you as well. All right, so we won't have a report from New York City Department of Health and Mental Health. I just want to mention, moving on to the next item, Connect to Me certificate program. I had emailed it to our committee members. Again, we get so many emails that some things I know will be missed because I missed some things. But I did miss it. I did email a couple of times the Connect to Me certificate program, sponsored by and the community health group led by Dr. Judy Gomez. And Dr. Gomez is connected to Northwell Hospital, Columbia University Irving Medical Center, and there's another big hospital or research institute that she's connected to. And they announced this program as a way to provide skills and professional development opportunity for community-based partners, community-based organizations and their staff, and their community center staff and researchers. And they have some sessions that can be seen virtually, and their last 3 will be available in person. But the idea is to answer a keynote speaker's challenge last year to research, I want to quote from them, to develop community-informed and responsive research that centers community health priorities to engage in transformative systems change and achieve health equity. And it is a certificate program. I've attended 3 of the 9 sessions, extremely informative. They have about 50 that are enrolled, and of course you get a certificate. But for those of us who are truly interested in keeping our community aware, being active in trying to erase inequities, it helps us know where we are from others who are skilled and professional in this area. So it's important for us to stay abreast of information that's out there, and there is a lot. There's too much for any one person to know most of it. And even among medical professionals, they often know their areas and a lot about other areas, but a number of them are participating as well as providing the research information. So I know that our committee member, Dr. Clotilde Mangulia, is, I believe, I saw her in the first session. Clotilde, you can say if you're able to continue, but there are 2 of us who are involved in the Connect to Me certificate program, and it's really exciting. Once we get in there, it sounds like, oh my goodness, will I be able to understand some of the terminology and all? But it's not heavy in that sense, but we do get to understand the challenges in explaining what's going on in healthcare, what's goes on in as it relates to particular ailments and diseases, if those questions come up. And primarily, I think it's just really important for us as a committee related to health and environment to be exposed. We will have one of the doctors, Dr. Jas, speak to us on climate and health. That is his area, connected to Columbia University Irving Medical Center. So he'll be joining us at some point soon. And there is a lot concerning community health as we begin to talk about climate and climate change even more. So that's it as it connects to the Connect to Me certificate program. And some time ago, 2 years ago, actually, or almost 2 years ago. One of the suggestions came from, or one of the persons that really sparked this idea was Dr. Olaji Williams from Columbia University. It was Barry Weinberg when he was chair of the board, Victor Edwards, our current chair, at that time he was first vice chair, and Edwin Torres, a co-chair of this committee, attended a special session sponsored by Columbia University Irving Medical Center on clinical research and trials. And when they came to speak to our committee, really well attended, another well-attended meeting. It was mostly virtual. There were about 30 to 35 of us online. And one of the big things was to make the community more aware of the importance of clinical research and trials among people of color. So that when we ask about information and wonder why there is no information coming from our committee, not from our committee, from our community or about our community, we will know, or people will know. And that they have to be involved in order to, and we have to encourage others to be involved so that we can get the data that we need. So it's really important, and that started about roughly 2 years ago. And we, from that point, kept the concept of clinical research and trials on our agenda. And we have people coming into the office, so hold on a second. We have more people. Yay, they're here. Oh,
Sorry.
So,
Yeah.
yeah, this is, yes, mostly online, but we do have, definitely a quorum in person now. Yeah, the entire committee is here, so whatever delays, we are happy to see them. And so that's what started our emphasis on clinical research and trials as a committee. And we've worked closely for a long time and with Columbia University Irving Medical Center. And through Dr. Brian, we had about 5 presentations on their most recent trials and the research. One, and I don't remember all of them right now off the top because we've had so much going on, but one of them dealt with oh my goodness, dealing with, I'll come up with the names. Oh my goodness, I should have even said that. Dealing with different illnesses, and I will get that information as soon as someone else talks, and I'll research and pull it up. So I went blank on those, but there were about 5 of them. So we're very pleased to continue that because we know that it's important. And our March public forum focused on just that with 5 researchers coming from Mount Sinai, Columbia, and Northwell. And they were very well received and doing very unusual research and very important research. As a matter of fact, one of the researchers, Dr. Yvonne Hurd, was recommended to us by our member, Monique Hardin Cordera, and people heard her research on cannabis, and they were rapt with attention. And one of the other doctors in the audience whispered to a couple of us, Edwin and me, this is Nobel Prize material that she has presented. So I'm very hopeful that that's the kind of recognition she can get on the international scale. So Monique, thank you so very much for recommending her. She also helped us find other researchers, those in the medical field. So that was an excellent presenter, and we're going to continue in that tradition. And later on in this meeting, you'll hear about another research breakthrough that happened, and Dr. Mangulia will report on what we'd like to do in reference to making that known to everyone. So having said that, I want to move to our presentations. There are 3, and we're asking you to present your basic topic, no more than 5 or 6 minutes, please, so that we can have leave some time for question and answer, and so that the other presenters will also have that amount of time for questions and answers before we get to our new business. And so we have first on our agenda, Dr. Evelyn Rich, and assisted by Ms. Victoria Penderhughes, to talk about an issue on Medicare and Medicare Advantage. They introduced it at the last meeting. They are part of an organization called CROC, that's the acronym that stands for Cross Union Retired Organizing Committee. And so let me just leave it at that and have Dr. Rich, I think you're going to lead off. Will you need to be made host for any flyers, brochures, you and Victoria, or one or the other? Okay, Dr.
You're muted.
I think, yeah.
You're muted.
You're muted.
No, you're good.
Victoria, I'm not sure if you need to, one of you, if you want to be a co-host, if you have flyers or charts or anything like that. If not, welcome, and we're listening to hear from you.
Well, we are working on a flyer. We're a relatively new organization, which has emerged as a result of an action by the mayor, de Blasio, who decided to transfer 250,000 municipal retirees and our dependents into a Medicare Advantage program. But I'm ahead of myself. First, I want to thank all of you for welcoming us to your meeting and giving us an opportunity to share with you concerns which affect all of us. So thank you very much. My friend and colleague, Victoria, is here to also augment my few comments, because I will certainly honor your request that we speak no longer than 5 or 6 minutes. So let me just begin by saying that health care is the issue of our time. And in fact, because you've invited us and you're the Health and Environment Committee, the environment is also the issue of our time. So I don't know how many committees you have in your community board. I belong to community board 7, but let me tell you to begin with that you're on target. Now, the mayor decided then to transfer 250,000 municipal retirees. And our response has been shocking to him, because he and his administration never imagined that retirees over 65 for the most part, and I told you, I share my age, I'm 91. I'm the oldest one. All right.
Yes.
We are fighting back. All right. Now, healthcare, retiree healthcare, I want to say upfront, it's not something that we're begging for. We were promised, and we worked, and we earned this healthcare. And when we were invited to join the staff of New York City, which has now over 307,000 employees, we were told that we would take less salary, but when we retired, we would be guaranteed traditional Medicare, all right, with a supplement that the city would cover. The mayor has gone back on that promise, and he has made a big mistake. Now, that promise has affected many, many people. And my friend, colleague, Victoria Pinderhughes, is going to tell you about her experience. Victoria.
Thank you. Thank you so much. Thank you, everyone. I'm really honored to be here and to be able to have some time talking with you. I did attend one of your other meetings, and I can see how vital the committee is in the work that you're doing. So I am a retiree. I worked for Health and Hospital Corporation from 1987 to June of 2021. I'm a licensed psychologist. I'm in a hard-to-fill title, and throughout my tenure with HHC, we were always promised that we would have health care. It came up not once, but throughout the 30 years. When we were coming on board in some of our monthly staff meetings, in workforce development committee meetings, it came up. Whenever we did, I did several financial planning sessions on my own, and even in the offboarding process of retirement, constantly came up. There was, especially at offboarding, because there were so many documents that had to be filled out to attach where my health insurance was and what it would switch to without interruption after I retired. I never heard that there was an issue with the health insurance until approximately October, November of 2021, when I was trying to locate my dental and my vision, which happened to be through the union DC 37. I did also go to managerial position, so I was in the management benefit fund, and I was attached to MEA, Municipal Employees Association. So I had to research some information. I found out by accident that when I went to the management benefit fund site that they were planning to change the health insurance. I had no knowledge of it. We always chose the plan we wanted, and here we were going to be shoved into something else without choice or consent. So I joined the fight. I joined New York City Organization of Retired Public Service Employees, who initiated litigation to stop this action. We are an older, we paid our dues, we earned our coverage. We are older, we have more health challenges, we are more vulnerable at this point in our lives, and there is nobody representing us. We don't have a vote. We don't have a say. We have done litigation, and that's how we're going to roll, because it's not right. And it affects not only me, it affects retirees across the systems and the current employees as they retire. Any changes that are made, if they change the city code, it's going to affect them. It's going to affect everybody.
Thank
I
you
would
so
also say that it might be better to look into the New York Health Act as an option that might be more viable for everybody, both workers and businesses, retirees, and people of all ages. But, you know, we can't accept this. We just can't accept this.
when you leave here today, Victoria and I want you to take with you 3 basic ideas. The first idea she ended with, this affects people across the system, across the country. Municipal retirees are fighting back. And now the mayor has decided he's going after the employees, the current, we call them in-service employees. So they are under fire too. And thus far, our litigation has preserved our traditional health care. The second thing we want you to leave with you when you leave is that traditional Medicare covers almost everyone who is 65 or more or disabled. So if you become disabled for any reason, Medicare will support your health needs. This is important, although it omits dental and vision and hearing care, and that's a weakness, which the Medicare Advantage people have seized. So that traditional Medicare is publicly funded, and this Medicare Advantage program that we're being pushed into is a private for-profit business. And let me tell you, there are three major companies that are making the money: United Healthcare, Aetna, and Cigna. And last year, each one of them made a minimum of $2 billion. Now, when you have traditional Medicare, you can go to any doctor who's in the system, and 99 and 44, 100% of the doctors are in the traditional Medicare system. And your needs will be attended to by your doctor. With the Medicare Advantage program, they have limited networks, which means you may not be able to go to your doctor. They delay and deny care. The last thing you need to know is that under the system, the federal government pays the Medicare Advantage provider for each client that they sign up. And what they do is not tell the truth. They say their clients are sicker than they are, so they can collect more money. I have to drink a little water. I'm almost.
Yeah, time.
Sure, no problem. I knew.
Don't rush that.
Laquita. Hi, everyone.
Hi,
Hi.
everyone.
Hi.
Hi.
Ms. Fitch.
Can I finish?
Yes,
Can I
please.
finish? I'm not finished. Okay. And finally, I want you all to know that we're going to win this fight with you, because you're going to contact your city council person. We have legislation in the state legislature and in the federal government. And you're going to contact your representatives. You're going to contact your friends, and you are going to educate them about what is happening. This is a fight that we're not giving up. We're not giving in, and we're going to win. Thank you.
Thank you very much. Thank you very much. Also, Dr. Rich and Victoria Pender Hughes, I was trying to find someone from Medicare, and just because as a community board, we need to hear, both sides, but we know that something is going on, and there are some detrimental changes that have been talked about for a while for Medicare and and Social Security both. So we really have to, there's so much, as I mentioned earlier, to be on top of, so much happening. This is really, really important. So hopefully we can address our community, ourselves, educate ourselves even more. Edwin, you were gonna add something.
Yes, I was going to add, Dr. Rich, thank you for your tenacity. I mean, I can only aspire to be where you are at your age with your energy. Because of, the work that your generation did, is that we're standing here today, and we owe it to you and to our society to create a better place for all of us, and not forget those who work hard for us and now push them to the side. I do not buy the rhetoric from the mayor that we have, that there's no money. Right now, I see overtime being thrown in the street in our community that has been militarized. We are being harassed. We had the protests that was taking place at Columbia and at CCNY. I walk by CCNY because that is right in my backyard. They never bothered me when I was going to work and coming back and forth. Now interacting with the militarized zone that we have, life is much different, and they're throwing dollars every single second by having a whole militarized zone. So the fact that they're saying that there's no money, there is money. It's just where they allocate the money to.
You're right.
So we have to remind our mayor and our elected officials what's happening. And Laquita and I and the committee, we will be writing a resolution based on this because this is something that affects health directly. We have taken on several issues when it comes to environmental health and looking at nitric oxide and how it impacts the community and the overall cardiovascular health of all of us, including asthma and other issues. Ali, give me 1 second, please. Sorry, I have my toddler with me.
She's
Give me this.
precious.
Yeah. But yeah, so we will be following up, and whatever material you have that you can share with us, please do, so we can write this resolution. Because it's horrible.
Well,
What's what they're doing.
Yeah, resolutions at least allow, our, council people, legislators know what is affecting and impacting our communities. But we need information. We need information, more
Yeah, so
information.
the way the resolution works is
Hold
that
on,
first.
Oh, hold on, can you, hold on for a second. Liz, oh, well, Dr., I don't know.
When you finish.
Dr. Rich and
when you
then Liz, and then I don't know if
When you
Monica.
finish, I have a comment when you finish.
Uh-huh. Dr. Rich, go on.
Yeah, I guess
She's
Mike,
Is she talking? Cause I can't. Dr. Rich, are you talking? Cause I think you're muted, if you are. She had started to say
She
something.
just
but-
muted. Yeah. No, I don't think she's muted.
yeah, I guess my two comments are this. One, when I first got here in January, I remember I'm working with a senior active committee, and I think we did pass through a resolution in support. I must check with them because I did bring it, because I'm an active, but I am a city worker, and I'm the one giving out. I met you, by the way, a couple of times. I was giving out the Retired Lives Matter buttons, and I was at the rally last week when you were singing Solidarity Forever.
Yeah.
Oh, right.
I've been on the field with a lot of the, because I am a city worker, and so, and I gave out the buttons, I made out some buttons, I think you had one on, Dr. Richard. So anyway, I think when I first joined the community board, I did bring this up to the chair of the senior action committee, and I think they did pass the resolution. It was before I even got on.
Okay, so let's try, Liz, can I ask you to follow up and check,
Yeah,
check up
sure.
on that?
Yeah.
And then it could be
Yeah.
shared again, because I'll tell you, sometimes there are a number of resolutions, there's so much. And I admit, some of them escape me or I made, and I probably voted for, I voted in favor. But it's just that there's so many, and we need to be reminded, and that whole accountability, we need to follow up.
I think I remember it as well being brought up, because Victor had made some comments around it.
Yeah.
Now, I don't know, Walter's next door.
Yeah, it was 'cause it
Maybe
was-
Pop in and go ask him.
Right, because it was
He
in
could email it
January-ish,
too.
as I remember, because I'm actually an active
Don't worry,
who's
Monique.
been working with this committee and working with a lot of the
Or ask
retirees.
if he could
And there are a
come.
lot of us actives who are concerned about it, and we do go to the rallies. We heard Croc speaking last week at the No More 24 rally, so we've been out there with you.
Oh, Liz, thank
So
you
we're in
so
support.
much
Thank you.
for that. Thank you so much. Because, so I am very pleased, because, our community board is pretty active. I'm glad, I think our committee, Health and Environment, is very active with, resolutions, trying to make sure what's going on in our community and that we respond to it. And things are happening quickly, and sometimes it's just, there's so many issues, and our community is in need. When I say our community, even though we're here in District 7 with the Community Board 9, as part of that, community really is definitely people of color, but it goes beyond people of color. There are a lot of people, regardless of color, who are impacted by this, by just the same thing.
So,
You know,
Laquita, if they can provide that reso to us so we can enhance it and add more from the health perspective and the social justice perspective,
Mhm.
and we can add some exhibits with the current, expenditure that the city is doing. They can't say on one end we have no money and on the other just throw money, like we have a blank check. So share that with us, Dr. Rich, whatever resource you have, share with us too, so we can draft it. The rest of what it does is that it will go through the committee, go to the full board. And
Hold on, Edwin, because Walter from Senior Action is coming in and Monique, she ran to get him. Oh, press that button right there. Press the button right there. Okay.
so then
Oh,
what,
this is great. Hold on, Edwin. So Walter, we're so happy that you happen to be here this evening as you are here with another committee.
Yes.
But Liz, our fabulous Liz Eastman, reminded us that did we have a reso from the Senior Action?
Talked about it, but enough should be put it in.
Oh, we did put
action.
it in? So we can work together. Oh, we can
right,
work-
so
Yeah,
Walter,
yes,
please,
all right.
Well, I'm a city worker, so it affects me directly.
Yeah.
Okay, good.
so,
Dr. Victoria, would you guys have
No, we talked about it, and Victor, we had one of our meetings, we talked about it, but we never put it down.
Okay, so we can.
So
Oh.
we'll work together, health and
No problem.
Senior Action.
Let me
Well,
get this
and-
out the way Friday, and I'm yours, whatever.
Okay,
Yes.
Let's see, Victoria and Dr. Rich, Walter's Committee Senior Action has a resource fair that takes place on Friday, what time?
11 a.m. to 3 p.m.
11 a.m. to 3 p.m.
at the forum.
at the forum at Columbia University, where you work for the Public Health Forum. Can
Right.
you come? I don't know if there's room for a table.
Don't, please.
He
All
bring-
welcome.
If you want
All
to
welcome.
bring materials for that table,
Yes.
do it. It starts at 11.
And don't forget to bring the seniors.
And
Yes.
bring seniors.
I'm going back to my other meeting.
I would be more than happy to, but I will not be in town.
And so maybe you can get it to the community board office, Victoria. I hate to put all that, I'm trying to think if I had known yesterday.
Yeah.
Laquita, so.
We'll, I was at a fair where I saw Victoria, but if it can come get to the community board office, that would be great, or else we'll talk. We'll talk and see how I can get the material from from you guys to
Mhm.
Senior Action, okay?
So,
Yeah.
Sounds
Laquita,
good.
can you put a,
Dr.
Oh,
Rich?
hold on, Edwin, I interrupted him, so then.
Laquita, can you put together, the reso, the resources that are gonna be sent to us, send it to me and I will write the resolution. Then we can share with Dr. Rich and her team, so they can give us some feedback before we bring it to the entire board. Dr. Rich, what can happen with this reso is that it can be used as a supporting evidence that you have the community behind you. If you go to other community boards, what they will do is sometimes they will copy the same and say, we support this reso. And the politicians, they pay attention to this because they see that the community is putting their weight behind it. And it's something important to all of us. So we will work on that. As soon as they get that to me, I'll make this a priority so we can get this running, because time is of the essence.
That sounds terrific. Thanks, Edwin, and thanks, Liz.
Just a quick question. So where do things stand now? That's what I was trying to understand.
Her last 3 points. Dr. Rich, can you repeat where things stand now?
We have litigation at
Okay.
the Court of Appeals. The state's highest court, which
Okay.
will permanently keep the mayor from putting us into this Medicare Advantage program. Now, we went to the hearing and we expect a decision anytime from now until the next 3 months.
Okay.
Oh, so we have time.
Place where we are. In the second place at the legislature, we have 2 bills, one in the Assembly and one in the Senate. And the Assembly bill, I could tell you the number, is 07866 and the Senate bill is 7383. But what they say is that the state employees of New York State are protected in the health care that they have as of 2022, and the state cannot diminish those benefits. And Richie Torres has introduced legislation in the Congress, and that legislation is pending. So we're fighting on many fronts. The litigation is one front, and then we have the rallies and the demonstrations on another front. Then we have the press and the community newspapers on still another front. And we have expanded now into Delaware, Illinois, Vermont, Vermont, New York, and New Jersey, okay? And we get letters on an occasional basis from municipal retirees from across the country asking for help and asking us to decide and share what it is that we've done. Now, the mayor is in big trouble, but he is in big trouble. But my friend here, Mr. Torres, understands that the city's budget, well, a new budget will be passed June 30th, but right now the budget is $109 billion. And what the mayor says is that he's going to save $600 million, which is 0.6% of the New York City budget, but he refuses to tax these millionaires and these billionaires who have money, and he operates on what we call an austerity budget. That's what the mayor does. He doesn't understand that we built this city, poor, working class people like us, and we're not going to let him take it away.
So basically, we're pushing, because July 1st is when the new fiscal year starts. So we're trying to get this pushed through so that we can salvage and get things back.
So we need to get
to where they're supposed to be. That's what I'm hearing, because that's why I was asking what the time frame is.
Right.
Thank you, Doctor.
Thank you.
I'm wondering, with this time frame and having to vote the way we do and having to talk to so many people, because the chair of the senior action was here and you guys have already started something and we're amenable to working together on it, maybe we can get a resolution done. Edwin said it'd be up to, he's a fast writer. And we'll be using the notes that have already come out of senior action and then comments from our committee. And basically, as long as we have the tape with Dr. Rich's comments and Victoria. So I think and plus we have people on the board who are retired working for the city. We have a lot of information. We'll try to compile it. Maybe it could be presented Thursday. Maybe.
I think we had something. I just have one final comment.
Yes, and then we have to move on to the next person.
Dr. Rich, I had one final comment. Thank you personally for what you've been doing. I've been sharing your videos and your speeches at HPD where I work to my younger set that are 30s and 40s. And they say they're tired. I said, do you know how old this lady is? And you've been sharing it openly.
Wow.
And I have embarrassed them. And some of them were out with me last week. And they've been out there and they've been giving out those if you've seen those Retired Lives Matter buttons, I don't know if you've seen them. I think you do have one. It says, we made those up and we were giving them out. And we saw you singing Solidarity Forever. And, when my young ones say, oh, they're tired, I'm like, you can never thank you for the inspiration to the next generation.
Thanks, Liz, for saying that. Thank you both so very, very much. Now, and I'm gonna see if Liz will somehow connect with Victoria.
Yes,
and
please.
To get the material for Friday, because I plan to be there on Friday, but I'm not sure what my time will be like to collect material. Thank you again so very, very much. And you're gonna have to come back and be with us again as we, get this resolution off the ground. And Dr. Torres, thank you, my friend. As always, we might need to call you on both Dr. Rich and Victoria for, additional comments as he's putting the reso together with the community committees. Okay?
No, yeah, I was just gonna say, Laquita, that, you guys are not alone, and thank you for advocating for many seniors who do not have either the platform, the social capital, or know how to work the system in order to advocate for themselves. There are many, many folks in the city suffering for this. I see them in my clinics. I see them in the community. And this is something that, it has to be said and done. And thank you for coming and speaking with us about this.
All righty now.
Thank you.
Okay, and now moving on to Mr. Darren Hoke. Mr. Hoke, I learned about you through our chair, Victor Edwards, who was able to attend the Montefiore Plaza meeting. There were two meetings that night, one with WEACT. I went to that one, had hoped that it would end in time for me to run down to Montefiore Parks meeting, which was held at City College. But I thought it was too late and didn't make it, but he did. And he had a chance to talk to Darren Hoke, who is the supervisor of Clinical Coordinator Neighborhood Response Unit in the Bureau of Health Promotion for Justice Impacted Populations with the Department of Health and Mental Hygiene. And Mr. Hope sent us the 988 brochure, which they formulated. But the issue around Montefiore deals with drug users, drug abusers, and then drug sellers. And so trying to come to some resolution on how they can be less intrusive to the community. Could be their community, but it's not a great thing in terms of the destruction of the park, the destruction, of course, to themselves and other young people who may see this and be somehow encouraged by it for a number of reasons. So we really, Victor really wanted you, Dr. Hope, to meet and present to us. And I am very happy to have the opportunity to have you speak on how to assist community members who require special needs. Okay, so Mr. Hoke, if you will unmute yourself and.
Yes, I think I am unmuted. Can you hear me?
I said 5 to 6 minutes because we like more Q&A.
Okay. Sure. Can everyone hear me?
Yes, very well.
Yes.
Okay, wonderful. So I do have a PowerPoint. I'm just going to share my screen. Host enabled participant screen sharing. Can you
make you? Let's see. Oh yeah, I can do it on my system. Hold on, he did give me that. Hold on, I can do it. Where's?
I got it.
No, I got it. Is that Monica? Who was that saying I got it? I got it.
Why? Got it?
Hold on. Make co-host. There you are.
Okay, let's see here. Share. The circle is spinning. Let's see.
Oh, has anyone picked up anything in the
okay.
In the chat that please share the reso with us. Who is this right here? Please share the reso with us. We will enhance it by maybe that was Edwin. Good, I can be
okay.
And also while Antonika James will be she'll be there to table at okay. All right. We're all set up.
Are you able to see my screen?
Let me just see. Not yet.
No, not yet.
Okay. I'm pushing. Let's see. No. Are you able to see it now?
No, if you go to share screen,
Yeah, that's what I did. Let me try it again. Let's
Is
see.
your PowerPoint open?
Bottom.
T Hope,
Yes.
Okay.
and see, he's co-host, see at the top where D Hope, DHOKE.
I mean, I saw his name, but it's at, yes, at the bottom, right, share, like,
I
right?
wonder if I need to do it from this.
What about now? Can you see me now?
It's
It looks like
changing.
it's coming, yeah.
It's loading, yeah.
Yeah.
Yes?
Oh,
Oh,
yeah,
wow.
probably
So we
just.
see you now.
Okay, are
Okay,
we up now?
There it is.
Yes.
Okay, wonderful, wonderful.
Mhm.
Here, okay. So good evening, everyone. Let me go to slideshow here. Slideshow. Where are we? Where are we? Slideshow. Okay. Well, we can skip like this. This is fine. So good evening, everyone. I am so glad to be here. My name is Darren Hoke, and I work with the New York City Department of Health and Mental Hygiene. I am a licensed clinical social worker, and I also have a master's in public administration. And I currently work in the Bureau of Community Awareness, Action, Response, and Engagement. So Laquita so nicely conveyed to you all that I worked in the Health Impacted for Justice Involved Bureau. But Department of Health often makes many, many changes. And so just after that presentation I did with Montefiore, they shifted a lot of my work into this new bureau that the acronym is called BCARE. So still doing very similar work. One of our aims is to partner with many committees, such as yourself, the Health and Environment Committee. So it is a pleasure to be here. It sounds like equity is front and center in all of the missionary work that you're doing. And just so you know that equity is embedded in the Department of Health and Mental Hygiene's mission as well. So we seem to be in congruence, and it is a pleasure to be here with you. So this evening, I am going to speak to you on the topic of assisting community members with behavioral needs, okay? And behavioral encompasses folks who may possibly be living with a mental illness, folks who may be substance use users, substance folks who may have a combination of both substance use as well as a mental health condition, which we call a co-occurring disorder. Folks who may possibly be homeless and also living with a co-occurring disorder, or just solely homeless, or people who have behavioral issues, such as maybe drug dealers, or folks who seem to pique curiosity in some of that kind of behavior. Okay. So the agenda that we're going to cover, I did the introduction already. We're going to speak on how you can help and engage as a community. Often people ask the question of what can I do? Like, this is happening in my community. It seems to be getting worse. It's very concerning. It's very disturbing. Children are around, family are around, you know, it's an eyesore, and it's really disheartening to see people going through this, right? So how can you help and engage as a community? Also, we're going to talk about the 988 mental health hotline, which Laquita briefly spoke to. We're also going to speak about mental health first aid training, and then some nearby resources, and then we'll have Q&A. All right, so we're going to jump right into it because time is of the essence. How can you assist? All right. So first, you can assist with engagement. So if you feel safe and the community member does not present to be a danger, Consistently say hello and aim to develop a rapport with that individual, which can hopefully lead to building trust. So many of the folks that use substances or are homeless seem to bunker down in the same area, which means that you often run into these kind of individuals. So, as uncomfortable as it may be, if that person does not seem to present any kind of harm or danger, or there's nothing imminent going on in that moment, say hello and introduce yourself. And then ask them, what is your name? Right? That's the first step. Now, they may answer you, they may not answer you, but at least extend a hello. This is my name. What is your name? If you do that, hopefully on a constant basis, when you run into this community member that needs assistance, that needs help, they will eventually start some type of conversation with you. That's the very, very first step. Now, for many people, it's uncomfortable, but try to lean into developing and getting to know this individual. Also, avoid giving money. So sometimes when you say hello or you extend some type of helping hand, they may or may not ask for money. So do not give the money, because the money probably is going to go towards them either using the substance of their choice, or it will not be spent where in a way that they can really support and better themselves. Okay. Also, while you are encountering these community members, be aware of your own biases, right? It's really, really important. So if anyone has never taken a biases test, I recommend that you take one, look them up. They're readily available online, and get familiar with your biases, some of the things that you are uncomfortable about with yourself that you don't really normally discuss, and get in tune with them and embrace them and push back on them. It's really, really important. It will make you a better individual and will also contribute to you bettering your community. Okay. Next, the action steps. So another part of an action step is to call 988. And later on, I will get into the details of what 988 is and what it does. So if you witness a community member who is exceedingly exhibiting concerning behaviors, such as harming themselves or harming someone else, or just something very significant that seems to be bordering dangerous, call 988. Okay. 988 is a mental health hotline that is a great, great tool that can guide you through whatever it is that you're witnessing. Okay. So 988 is a hotline that is used for individuals who are in some type of mental health distress. It is also for a concerning family member, community member, caretaker, who can also call on behalf of the individual that they're taking care of, or a community member that is presenting some type of concern. If a community member does accept your help in the process of you reaching out to them, again, call 988 so 988 can guide you through the steps so that they can be linked to the most appropriate service that they're in need of at that moment. Okay. So let's talk about what 988 is. So 988 is a free, confidential 24/7 connection to mental health and substance use support via call, via text, or via chat at any time support is needed. Okay, so it's 24 hours, it's 7 days a week. It is a great, great tool. Once upon a time, 988 was called NYC Well. For those of you who may have heard of NYC Well, which was a part of the Thrive programs from Shirlane McLean, Bill de Blasio's wife. She had all of the Thrive programs. Well, NYC Well was a hotline that fell into the Thrive category. That has since evolved into 988, which is the same concept as NYC Well, was only focused on New York City, but now 988 is all of New York State. So 988 covers all of New York State. So anywhere you are in New York State, you call 988, you'll be connected to this hotline. But once you tell the person who accepts the call that you're called from New York City, they then will transfer you to what's called the old NYC Well, which is familiar with New York City. Okay. So NYC, so 988 is if someone is in need to speak to someone, they're feeling perhaps depressed, they may be experiencing suicide ideation, they may be delusional, but they're definitely going through some type of mental health episode. Maybe they have taken too much of the substance that they're using and they're experiencing other kind of symptoms that are very, very problematic and kind of can be hazardous. They also can reach out and talk to someone and get connected for help. So it's free confidential support for someone to care about. There's trained counselors who listen and help without judgment. So these counselors are highly, highly trained. So not only do they have trained mental health counselors, they also have peers who take calls. And peer is an interchangeable word, but under this context, a peer is an individual who has lived experience. So a peer is someone who knows about substance use. They perhaps used to be on substance use and they're in recovery now. They are familiar with the hospital institution and all of the systems involved with the psychiatric ward. They also have been justice involved, so also very familiar with our prison system. Sometimes people need to talk to someone who has a shared experience as opposed to talking to a counselor. And they also will provide 3 referrals. After they have this conversation with you, they're going to ask many, many questions throughout this conversation because they really need to rule out that you're not suicidal and you're not going to cause harm to yourself in that moment. And once all of those questions are asked, they then will get to the root of what's going on with you. And then they will then provide you with 3 referrals that is appropriate for that person at that time. So that is what N988 will do for you when you reach out. So you as a community member, if you have developed a rapport with one of the community members and they say to you, you know what, I'm ready to go to detox, or I'm ready to go to a rehab, you then will say, okay, let's sit and let's call 988. You call 988, they'll ask you a litany of questions and you will answer to the best of your ability. You explain the circumstances around your call, and they will then provide you the steps to get that person to a rehab. Another.
Oh, it's getting close to wrapping up for some Q&A here.
So another point of reference that is mental health education for the community is what we call mental health first aid training. So mental health first aid training, you could reach out to this website or DOHMH website. We host a variety of mental health first aid trainings, which target mental health training for community members. It gives you 8 hours of what mental health is, all the various components of mental health, and what to do when you are trying to assist anyone get linked to mental health resources. So some of the resources that are close in your area, in your community, are homeless services on Lenox Family Center. That provides homeless services. And then you have also a harm reduction service, which is called On Point. That is also on 126. Harm reduction is getting people to gradually decrease whatever it is that they're doing that causes harm to themselves, right? We no longer try or recommend an abrupt stop to whatever you're doing. We try to encourage people to gradually stop because that's what's more successful. And then we have Harlem United, which is in your area, which provides a lot of HIV services and also housing services. So Q&A.
Thank you so much, Darren, for that presentation. I think it's very helpful, practical, useful information. I wish we had had it even a year or so ago. Back in January 2022, when I started as a co-chair of the committee, there was a great deal of conversation about mental health issues. And during that time, during that first month in January 2022, we decided that we would have something dealing with mental health at each and every community, our committee meeting. And we pretty much done that because we know that after, following COVID, it was happening before COVID, but especially following COVID, there was there were a lot more incidents, a lot more occurrences that were just frightening a number of people and just having everyone on alert and in alarm. So this is very important, and you really helped, point by point, assist us in how to handle it, because we haven't had very much related to that part of how we as individuals and in the community can work. I don't know how we can eradicate it, but certainly help ease the situation with the person who is going through their episode, as well as probably calm down some others around us who are seeing what's going on. And just one other thing before the other questions, Be Care, is that part of the police, also with the police department?
So no,
Be Care.
Yeah, Department of Health is a very large organization, as you already know, right? You had asked in the beginning if someone was present from the Department of Health and Mental Hygiene, and
right. We work with them all the time, but I'm just talking about that one program, B, the letter B and the word care. Is that the program?
No. So that's behavioral.
Okay.
Yeah, that's the Bureau of Community Awareness Action and Response Team. So the B is for the Bureau.
Okay, because there was a program with the police department too, where clinical psychiatrists or psychologists, whichever available, would go out, and then a couple of police officers. You remember what that was called?
Yeah, that's called our CRT. So that's that's our community response team. So
yeah, okay.
So they work with NYPD, and if someone calls to report a mental health episode happening, and this person has a history of violence, then the CRT team, which is licensed clinical social workers and NYPD, or psychologists, will go to that response and do their best to de-escalate and try to get that person either hospitalized via using what's called a 9.58, which is an involuntary removal, where police will put that person in handcuffs and escort them to the hospital along with the worker. So that particular team sits in our HIP-JIP bureau, and they're going to be transferred to our Bureau of Mental Health bureau.
I didn't mean to get off on that, but I appreciate having the explanation again. We have two question statement combination, Monique and then Monica.
Yeah,
let me see if
that
somebody-
was one of my questions, and maybe Monica is gonna ask further about how you might work with that CRT unit. But my question is, by working through this, bureau or your unit, how are you able to cut down the time needed to get somebody access to behavioral health services? Because we know there's a large delay in terms of people getting access to those services. That's a major problem. That was one question. And two, do you do anything in the area of pediatrics? Because that's also another area of need where young people are in need of these mental health services and they're not readily available as well. So that also poses a problem or concern. There's something written in the chat, which I cannot see from here, but those are my two questions. Thank you.
Thanks,
Okay,
Monique.
so that's a good question. So we do not link anyone to care, right? That's not this, because we're New York City. We're part of the New York City. Our role, I'll speak for my bureau, right? The Bureau of Community Awareness Action Response Engagement team. Our role is to respond to mayoral complaints, right? And try to go there to either mediate, try to provide observations, provide recommendations, as well as make appropriate linkages within the resources that we have. So we don't actually take that community member and then place them into any particular service. All right, so we will then provide a resource, and then a resource such as a nonprofit, such as a shelter, such as a clinic, whatever other behavioral health, whether it's psychiatric or medical, they will then kind of take over for that person. Okay, so we don't do that directly. And in terms of working with children, yes, I totally agree that our youth are in need of an array of services. Sometimes it's mental health associated, and sometimes it's shelter associated, right? Because a lot of youth are homeless at this point, and sometimes it's getting connected to medical services as well. But again, we then will connect them typically to DYCD, right, which is the Department of Youth and Community Development. They more so handle youth, but we will try to get them connected to the most appropriate resource via a linkage. Okay.
Hear that acronym again, please?
Which acronym?
The last one dealing with youth?
Yes, Department of Youth and Community Development. So perhaps in your next community meeting, you may invite a representative from DYCD to speak specifically on youth.
And if you have a specific contact, because that could get a little unwieldy also, phone number and contact.
Yeah, I can follow up and get a contact for you to reach out.
Thanks, Darren. She knows. I mean, I know. Okay, so Monica, we're ready for you, and then Clotilde.
So are you working with the police to keep them from killing these mentally ill people? You said that psychiatrists or skilled trained social workers are supposed to be going out with them. There's been since January about 8 mentally ill people killed by the New York City police. A few days ago, they released the body cam on the latest shooting. This police officer engaged in no de-escalation. There was not a mental health professional with him. The mother called and said that she needed help. In one of the instances, the young man called the cops and said he needed to be taken to the hospital. He was having a mental break. And the time from the police arrival to the time of that person's murder was basically seconds. So there is an ongoing issue. This mayor does not talk about it. the police commissioner does not talk about it, and the community does not talk about it. But I wanna know, who is intervening on these calls when people call specifically for mental health problems?
Mhm. Okay, so that's a great question. So, so remember that the Bureau of Community Awareness and Action Response and Engagement Team, right? We don't work with the police, right? That's another division of DOHMH that does. However, I can answer your question. So when it is very, very important that you yourselves, as well as the public at large, when you are having a mental health episode, when you are witnessing a mental health episode from a family member, from a community member, you call 988. 988 connects you to mental health professionals. If you call 911, you get the police. NYPD, for the most part, is not trained in mental health. NYPD is trained to enforce the law. Enforce. Mental health professionals support. NYPD enforce. They're two totally different modalities, which will probably have very different outcomes.
Yeah.
So under those circumstances, NYPD was called. And so again, NYPD is not trained to handle mental health episodes. However, there's a small population of NYPD, such as the NYPD that works with CRT, as I mentioned to you, which is another division, another office in the Department of Health, who works closely with other mental health professionals. They are more abreast of mental health services. CRT was not called for that lady. Or other officers who have great mental health experience and work closely with mental health professionals, licensed clinical social workers, and psychologists, they were not called. So it is imperative that when you make this call, you're calling the right help.
But let me just say this, the people in the community do not know that. They call 911 because they think that's what they're supposed to do. But why is it that these operators, instead of sending the cops, because that's who showed up at that door, why don't they say, hold on, I'm referring you to, what is it, 988? 988. I mean, what do we have to do? Please advise us. What do we have to do to get that to happen? There needs to be public health announcements that says, do not call 911, call 988. And we also need to be training these operators to call 988 because every single murder came from people that called 911 from help. So advise us, please.
So, the 911 operators, they are supposed to be trained to transfer the call to 988. For the most part, they don't. I think by default, they just resort to their own police force. I will say that 311 operators are better. They seem to be able to connect to 988 when it is deemed appropriate. But you just need to bring this to your community members, and legislation, and getting and pushing the mayor to inform people about 988, whether it's commercials. I remember at one time when de Blasio was in office, there was many commercials on NYC Well. I don't really see those commercials anymore, but it really is a way of getting that the word really needs to get out.
You're
And
absolutely
the way you
right.
can do that is through legislation, putting pressure on the mayor, you know, and whoever has some type of power to really move the needle in this area.
That, again, that's just one of so many issues that impact us right now that, and perhaps maybe a resolution can come out of that in saying, let's put some energy behind the 988 and encourage just getting an information campaign out about that. Maybe that's what our resolution could do so that the community is more informed. Great questions, you know, Monique and Monica. Clotilde has
Yes,
a question
yes,
statement.
thank you, Darren. Very, very informative. This is Clotilde. I didn't know about the 988. To
Right.
be honest with you.
Exactly.
Oh, this is a game changer. But now, when we call 988, I would like to know if those responders are trained in different languages.
Yes,
Because
that's an excellent question. Excellent question.
we talk about the need of our constituents. And as you know, we have a big influx of people who have been coming in New York, undocumented. And those people really face a lot of mental health and are left out. They do have a cell phone, most of them, but about the language, this is one. The second question I wanted to ask about the resources in the school. Do you have representative as well who speak the language of those students? We talk about the West African community, French, Wolof, Asian Creole, and other languages, and the Hispanic community. I would like to know about the school resources that you offer, because I know sometimes the school can be very overwhelmed and they lack resources, but do you have something very specific to address that? Because we also talk about children who are on the shelter, on the shelter. So what are
What programs do you have?
Sure,
Or
I can answer that.
partners?
Yep, that's an excellent question. Thank you so much for bringing that to the front. So when you call 988, particularly in the New York City area, that contract is charged with having Spanish speaking counselors and peers, Chinese and Mandarin speaking counselors and peers, obviously English as well. And then the 988 also uses a translation line.
Yeah.
They will then connect with a translator who speaks the language of the individual that you are providing assistance with, and they will do the translation. So yes, the conversation itself does take a bit longer because of the translating back and forth. However, the language line that New York City uses, that the Department of Health and Mental Hygiene uses, we have access to over 200 languages. So I myself have been connected to a Wolof speaker, French, Russian, Georgian, you know, all the languages that was needed for that particular individual. I was able to connect to. So that's what the Department of Health uses, and also 988.
And thank you again, Darren. I have one bit of information from the chat that Monique drew attention to. That comes from Antonika James, who is with Housing Works. She wants, and this is so all the others can know as well. You can add Housing Works Community Healthcare to your list of harm reduction resources, as we are also located in Harlem, currently at 1731 Park Avenue, and will soon be located at 145 East 125th Street. So these are facilities, they're not in our immediate district, but obviously they're servicing people or will service, see, Housing Works Community Health.
I just wanted to thank you so much for that from Housing Works. I appreciate that. I just wanted to put like a few resources up, but know that 988 has a plethora of all of resources. So housing work, you can be assured that you appear in a part of the resources for whatever services that you serve in that category in the 988 catalog, along with every other substance use, mental health, HIV, you name it. That's why we use 988. That's because we needed all of this information to be mainstreamed and streamlined into one area. So they have every single organization and what type of service that they provide. That's why 988 is going to be your go-to.
And I think that's what our resolution can promote and tie in the way Monica worded the distress and anxiety and heartbreak that comes from calling calling 911 and you get the police. And the next thing you know, these people want to help their son, daughter, husband is dead. And that's the last thing they expected. They just needed some restraint to be helped with restraint. And oftentimes they're not armed, or if they are, the police should be trained in how to handle it.
No, of course, and all of those videos, you could see where the officers engage in no de-escalation, and I have to be honest with you, particularly that last video, there was absolutely no reason for that. He was far, far away from that. I mean, it's just, they're all bad, but that last one's just devastating, and we will be paying. When did that happen, Monica? I don't know, a recent April, I wanna say. Wow.
And it happened within seconds.
Yes, it's just too many sad things. That happens more quickly with people of color.
Of course, in our
Happens
community,
more.
it happens extremely quickly, without any thought.
Any thought.
Yeah.
Well said.
thought.
And it's the same thing we say over and over, but we have to say it over and over and try to act on it. And I think the resolution is the next
I like
one
what
thing.
you said, Laquita, lastly about.
I don't hear anything. Did we go on mute?
Yeah, I think they're on mute.
Oh, okay. Can you hear me?
I can hear you.
Okay.
I
Laquita,
hear you too. I don't hear them.
Laquita, we can't hear you. We can't hear.
Her other device is gone. She had another screen up with her face on it. I don't see that anymore.
Can you hear me?
Now we can.
Those on the, those online, can you hear me?
We
Yes.
can
Anybody?
now.
Yes, now we can.
Okay, okay. Something happened to the cable on the big, system that's here and the community associate left out, so as long as you can hear me right now, we'll continue. Okay, Monica, and it won't be that much longer. Monica, you were saying, and Monique, I think there was something being said that you guys,
No, I was just saying just the tragedy, a family member calls thinking they're getting help for their person, and then they witness their family member being murdered.
the last day
I
or
mean,
moment of their
that's
life.
the worst, and that is additional trauma. So it's gotta be stopped, because it happens too often in our communities, in our communities.
Exactly.
And please know that this is not an issue of our mayor. This is not an issue of the police commissioner, as far as he's concerned. All the shootings were justified. But we need to change it. This is happening in our community far too often in every borough.
Thank you very,
And I
thank you
completely, I
very, very
completely
much.
concur.
And that's an important note to end on. Darren, an invaluable presentation. And we will hopefully hear from you again. Don't forget to send me the direct contact for DYCD so that we can enlist them for the youth angle
Okay.
of mental health, okay?
Yes. Yes. Thank you so
I
much for
hope you can
having
hear
me.
me.
Yes, I can hear you.
But they did say they could hear on my system a little bit, but I'm sure it's not as well. Darren, were you able to hear?
Yes, I did hear you. Can you hear me?
Okay, I'm not sure if he was.
Yes.
Thank you all. For those who could hear. Okay. How I'll
Now
mute
you have
myself.
an echo.
I'm gonna log off.
Thank you. Good presentation.
Okay. Thanks so much, everyone. Bye-bye. Alrighty.
You're on mute, so we can't hear you online.
I don't know. Can you hear me okay now?
Yes.
Okay, thank you so much. I'm not sure, is Caleb Smith here? I talked a bit about him, but I had to be turned off or muted because we have a couple of systems on and it would just be an echo. So we'll move forward. We'll have him present. Rainproof NYC was developed formed back in November, I believe it was, last year. And they have been working diligently and with a lot of commitment to look at how New York City and actually in New York State as well, but New York City can monitor and manage the heavy rainfall that has started to happen and is anticipated more greatly in future months and years to come. And not that many years away from it as well. So there have been some subcommittees established. He did a wonderful presentation at a conference, Rainproof NYC conference I went to on Wednesday of last week. And so I asked him to speak. I'm sure it was at short notice, but he said yes, but he may not have gotten all the communication. So we'll have him in June, along with Dr. Nash related to climate and health. So at this point, let me just see, hold on, get my agenda together. At this time, it concludes the presentation of guests and with announcements and all. And we're going to move into new business, and I'll try to do that pretty quickly. We saved some time by not having Caleb here. Let me just mention that we have one of our facilities that lost funding. Recently, every time I've heard something with the mayor, it's been related to a loss of funding. Like the libraries lost the funding and people were anticipating online, people emailing and people in various chat groups and they're really disappointed and like struggling to try to understand and try to get certain things to happen. We have a mental health organization in our community that lost a great deal of funding that, because of loss of the clubhouses. And, and so they are looking to just cut back on clubhouses. And it seems as if, there were, let me get my notes together, on that.
So who exactly was defunded?
Emma Bowen.
Yeah,
Yes.
really?
And we got a letter about that because we have been, we support our institutions. They're the oldest in the area. I put a call in actually to Barry because he knows in terms of government funding. Maybe some suggestions in terms of things we have to do. Certainly we have to write. The agency itself is, of course, taking up the mantle and working diligently, writing their letters. They have been in touch with the Manhattan Borough President, who will get back to them over the next couple of days. Only in our area, there are only 2 clubhouses that have been refunded, and that's in Harlem, Phoenix House and Fountain House. Phoenix House is in central Harlem. I'm sorry, Fountain House is in central Harlem, and Phoenix House is in Harlem, and it's a new clubhouse. Let's see, it seems as if Goodwill Industries was also in East Harlem was funded. Venture House in Queens was funded. New York State Disaster Interfaith Services that has a clubhouse downtown Manhattan was funded. So all the rest, and I believe that there were 16 clubhouses, and these clubhouses help those who are, dealing with mentally ill substance abuse issues. So it seems as if the area that we think might not need to be defunded rather, has been defunded.
Yeah, and just so you know that for our clients who have mental health issues, many of the programs that were assisting them shut down during the pandemic and never opened back up. I mean, what you see out here on the streets is a direct result of these programs that shut down during the pandemic and never reopened. So I think the community does not realize that. We had a program that was defunded. We didn't realize it till all of the people who were going into treatment court told the judge that they could no longer go to places to get their medication because they had shut down. So we need to realize that what we're seeing here in our streets is a direct result of the defunding of these programs.
And it seems from time to time over the last just few weeks and also a few months, I am seeing more incidents or people, you can see by the way they're dressed or by the way they're behaving. It's like more and more are coming back. And the same with homelessness. There's seemingly, just from my visual, I don't have the statistics yet, but just from the visual, there's more. So we're in a real crisis situation where we have so much to address.
Yeah, as the weather gets warmer, people come off wherever they're seeking shelter, and they're more open in terms of laying out and what have you, and it's the problem is also these like little SRA programs are decreasing, right? And people don't want people in their neighborhoods, but the reality is people gotta have somewhere to go. And the safety net, people don't realize the safety net that we had before the pandemic is gone. It's not a priority of the governor, and it is not a priority of the mayor. At least with de Blasio, there was some focus on that.
Right.
There is none now. His singular focus is law enforcement.
It's law for more and more money to law enforcement.
And it's costing us money because more and more people are suing the police because right now they are acting like they have no sense. And so this is where our money is going. Right.
It's more, it's more than sad. We can devote some time, we've had some excellent presentations that can help guide us, and we have to see how we can package all that for some meaningful reaction and movement. And again, our committee has done a lot in terms of trying to meet current issues, particularly as it relates to health and mental health. But I mean, there's so much more to be done and stated. I want to, want us to think about, I guess, ways that we can address this issue generally on mental health and the funding with the mayor, and not just perhaps one agency. We may have to just address that category for funding while putting some emphasis on our particular agency that has been working with the mentally ill since 1987. Or longer than 1987, I should know, since 1969.
Do they
And,
know why it was defunded? Did something happen?
When I talked to the board chair, she felt that they, the new commissioner that came in was at one of these clubhouses. And I believe in talking to his people, they wanted to take away funding from the smaller clubs. Smaller ones would be servicing 300 and less, and devote to those that had larger populations. That seems to be their rationale.
Right, but
from what we
nothing else
know.
up here.
But there's exactly, that is what's in our area, and then the longest, and their record is good. Their record is
Well, I
very
mean,
good.
look, I could see if Columbia was willing to step up and take over, which is maybe what we really need to do, because Columbia gets more NIH funding than any other institution in this country. With that money comes responsibility, and we have never held them to the standard where they do what they're supposed to do and which they're required to do.
I was gonna say, I mean, Columbia, this uptown by itself, you have the Psychiatric Institute.
Absolutely, and I think.
Yeah,
we
that's
need
at
to-
their facility, that's right there,
And
it's right there.
that's where those experts in this field are housed. So
Right.
certainly they have the resources monetarily and skills.
Absolutely.
And that's right uptown, right?
So if we need to, I'm more than happy to go have that conversation. We also need to
We
have.
should have a meeting, not necessarily coming here, but actually a meeting.
We need to have an actual meeting.
Yeah.
And we also need to have a meeting. My friend works for NIH, maybe I can get some guidelines out of him. But we also need to have a meeting with Mount Sinai to say, look, we are in crisis.
And they they did respond to the letter, but they haven't responded. So there's a conversation like,
Right.
well, we want to do this, but then they were undergoing challenges and some upheaval as well, seemingly. And so I think our letter did have some impact, but they also need to get back to us. Exactly. So it had impact.
And maybe, we want to get the media involved in that, because you remember, a lot of people, they'll say no behind closed doors.
Mm-hmm.
And it's a serious issue. Nobody knows that Emma Bowen is being defunded. We've got to get that word out. And maybe we need to go to, I'm being honest, maybe we need to go to the meeting.
I think we need to brainstorm on just that. And maybe not just that, but for our committee, certainly. But there are some other key issues. The libraries, my goodness, but.
He said his issue is getting to the library safely.
That's what he said, the mayor?
That's right, he said, that's why they get there safely, so in other words, more police.
I didn't hear that.
The library safely.
But
the
get in there
library
and
is
say-
another shelter during the day.
Say it again?
Yeah, I mean, library or shelters
No shelters, that's where people send their children who can't afford after school.
Yes, yeah, I've seen people there, yeah.
I'll see what youth education, and we work very well with, with them and the youth. I'll talk to Shanika
Yeah.
and Deirdre.
It's a safe space, like you said,
Yes.
for families
Yes.
that don't have childcare. And probably in some cases, it functions as shelter for people who need a place to rest their head. We close their eyes, that's.
Oh, they're not allowed to close their eyes that there's a security guy that goes around.
Oh.
Yes, yes,
Really?
you cannot sleep, you have your eyes closed. Oh, yeah.
Excuse me,
At all of them, because I really like libraries, and not that no one else does, it's just that I've used them because of,
Oh, okay.
the facility
I stand
access.
corrected, but the libraries are always the first on the chopping block when cuts have to be made. That's because nobody shares.
Yeah.
I also think that our politicians don't understand the roles that library, the role that a library plays in a Black neighborhood is different than the role that a library plays, on the east side. Right, I mean.
Now, I'm not sure how many people participated in the participatory budget. I did, and I know that I did vote for one of the libraries. I'm pretty sure I did. There was something that was put in related to the library. It was too late to add anything to participatory budget related to any project. So I did vote, and I don't know if I don't know when we'll know which ones get the funding. But that's the kind of thing we just gotta really stay on top of also. So, okay, so I have it written down. I don't know if we need a task force or something.
Now let me ask you a question. What is Sean Abreu saying about all of this?
About which?
About Emma Bowen being put?
I have not reached out to him, but I know that the Manhattan Borough President has been reached out to by Pat. I wanted to make sure we reached out to Emma Bowen first to see what they were doing, what their thinking was.
But Sean
And
votes, and that vote is coming up, so we need to make sure.
Yeah, I need to
Yeah.
make note of several things that came up here tonight, and we have a short amount of time to do
Yeah.
it. So if maybe as a committee, we're a small enough group, 5 of us, we can just do it by Zoom, by telephone, and just remember, jot down some ideas, and we come up with, I know we need resolution, probably, this looks like about 3 different resolutions.
Right.
Right now, we talk about the
Okay.
988, we talk about the support for
Mhm.
Amabua, and the third one will be.
The first one dealt with the Medicare
Oh, yeah,
Advantage,
Medicare, yes,
taking
thank you.
away, certain things being added in.
Right.
And they're in litigation, so we probably need to support the litigation, but we can get more information on that. There are 2 bills now, that one before the Assembly and the Senate. And then, Representative Richard Torres has one, Congress on the federal level. So we need to probably support. That might be a little easier. We probably need to support what they're already doing or about to do. And they haven't been voted on yet. And then with Darren, the emphasis on getting the word out to I guess maybe the word is warn people about 911, that we need to be calling 988. And
We're not warned, but alert.
yeah, alert, right? We'll come up with the right,
Yeah.
in some ways it's a warning, but anyway, yeah, you're right, alert.
Yeah, warn sounds ominous, alert.
It does, because I object to the word myself.
Yeah, we want to encourage.
I
guess
object to
that's
it
the
myself.
right
I
way
stand,
for people to proceed.
I stand corrected on that. And then, the other deals with, Emma Boyd and some of our, institutions, because the reason that one of the main reasons the community board exists is to protect its institutions.
Correct.
Community institutions. So I used to hear that all the time from one of the chairs. Okay, so we have our work cut out for us. Moving along. I want to thank Clotilde for bringing up the resolution, seeing it supported by, I think it came out, was certainly New York State and New York City Council have the intro read the bills and legislation that has passed. And it seems like the New York State Sickle Cell Advisory Network has pushed that. With Clotilde's visit abroad to one of the conferences, when she reported back to us from London on the success of the gene therapy with sickle cell, that was really super exciting. And yeah. And then both Victor and Edwin, I'm not sure which one was first, but I saw them at the same time. They were like one right after the other email. So I emailed to the committee. I get the New York Times, so eventually I would have seen it, but it was just exciting news. Because it ties in not only to our saying that we wanted to do something with sickle cell in a discussion format, but also our pushing clinical research. We've been doing that for the last year and a half. And then we've been also wanting to encourage clinical trials and not be thrown off by the syphilis study that keeps coming up and people not wanting the COVID shot, whatever reason. They have their reason, but if we don't have, we're constantly asking for data, for statistics. Who knows about us? Who has studied us? We're complaining, but we also need to encourage people to participate. And we got great news this morning, and our prayers and blessings to Kendrick, this young boy, 12 years old, who somehow qualifies for whatever needed to be happening with his body, qualifies for this as the very first person in the whole wide world on gene therapy, for the gene therapy being introduced. He's based in Washington, D.C. You all have the article, so when you get a chance,
But
please read it.
Howard has done, I mean, they've done that research. That was all, people don't realize that was all Howard University.
And that's what I wanted to know, who really did it.
60 Minutes piece done about 2 years ago when they had the first breakthrough.
Uh-huh.
But yeah, it's all.
And that's something also to be very proud of,
Absolutely, of course.
and I'm sure it also encouraged, the lady who's former wife of Jeff Bezos to give all that money to, Howard's one of the top medical schools. Mhm. Yes.
Yeah, but I don't think she gave it to them.
She gave some, she gave to 3 medical schools. Well, yeah, you're right. It was Meharry, there's one in Texas, I believe, and Tuskegee. I think those were the 3 medical schools. But Howard got something from them though.
Well, that's good. I mean, sickle cell's been an issue that we've been grappling with for decades. And anything that can be done to improve in terms of treatment and the way people live their lives and they don't have to suffer.
Absolutely, they say
it's important. And that is inside.
They say it's.
My goddaughter died from sickle cell.
Really? So you're one of the.
People don't realize that a lot of Black children die.
The more we talk about our community, the more we can see family close to us who have been impacted.
Well, at one time, you're absolutely right, Clotilde. At one time, Dick Campbell, he was older at that time, he's since deceased. Dick Campbell was his name, headed up the Sickle Cell Foundation near Columbia University on Amsterdam Avenue.
Really?
And for long, he would go everywhere talking about the importance of fighting sickle cell. He was almost a one-man warrior, one-man army with that. And other people, of course, joined in. But
when the money ran out, and
that's the problem. The money ran out, and
now
like everything. Yeah.
And unless we have our millionaires and billionaires, well, now we have some billionaires.
We do, have to take it on as a cause.
Yeah, we have to, and then we have to do more of that fundraising. Yeah, so, Clotilde and her, let's deal with the reso first, and then, talk about, the meeting and
Okay.
What we hope can take place June 19th, if not, it
Yes.
doesn't have to be right on June 19th, it
no,
could
no.
be end of June, you know.
Yes, so to be, because of the interest of time, so we do have two results here. The A1839, this one is for the Senate. It has been introduced by Senator Sanders, Brookclear, etc. And this has to do with education. So it's not the treatment, but it's to dissemination about screening information among the community. And this is more for the New York State.
Did it get passed?
This act shall take effect immediately, this one.
So it was voted on and
The Senate
passed?
bill?
Cause I copied it, but I didn't have a chance
I didn't
to,
read it throughout, but this one.
no, from the legislature. It would have to, maybe we can look that, if
Yeah.
someone has their computer, I have mine up, but I probably
You
should
want to
change it.
look at it?
Yeah, we need to see if it was passed. I was under the
Yeah,
impression
but
that one
it
of them
did
was
pass,
passed.
but she won't sign it, which is a problem with her.
Senator Clear?
Holco, you know about Holco?
No,
Oh, the governor?
Oh, the governor,
Yeah.
Holco.
You need to, you can pass anything, just so you know, they passed the wrongful conviction act. She would not sign it,
Oh, okay.
so she's a problem child.
Yeah, she supported the maternal, the
Yeah, she did. That's
maternal
one thing.
mortality,
That's the
but,
one thing
an
she
infant.
did
Did she
do.
sign?
She did sign.
But we don't know, yeah, that one she signed, yes, and talked about it. Now, the one that Clotilda's talking about, that's New York City Council passed it November 2023.
But did he sign it?
That's what city council, I don't know, the mayor, I don't
This
know.
one, waiting for the mayor's signature. This
The
is
New York
one-
City Council, but it
Yeah.
passed city council.
Yeah,
Now,
968 and the result 0771.
okay, now the Senate one, is that up for a vote? If you can let us know as quickly as, maybe, can you go
Because I
online?
was not aware, I just got it.
Yeah, that's the key, at least to see where it is right now. I copied them, but, I mean, I had them printed and sent to Hakil.
So this one here that Clotilde and Sharon, are we reviewing it to vote on it?
I think we should encourage it and vote on it, yes, both of
So
them.
it passed the Senate?
We don't know, see, let me look.
Yeah, we
There's
need
two
to
different-
call Cordell's office and find out the status of this letter.
Or Clotilde, right, do you have internet on your phone? Can you just
Yes, I-
put in status of sickle cell disease bills in New York state of New York? And then do another one, the status of sickle cell disease legislation. You can put the number in there if you want, 1839-A, I see here with the Senate. And then of New York State, and
If you
then
go faster than
search.
me, you can.
If anybody else can, see and do it, or, cause I just put in sickle cell disease bills and I got these two and these are the ones. But I think it would be great to
So-
support even these.
This one, yes, she signed. Yeah. Governor Kathy O'Shawn today
Holco.
signed a legislative package to strengthen healthcare in New York City, legislation S 1839A.
Okay, and what's the date on it? I thought I saw something April.
December 8th, 2023.
Okay, so that's,
December?
yes, they said she signed it.
Okay.
And so that, but I think we should vote, well, I'm asking for a vote of approval. It cannot be bad. Everybody can look at it very quickly,
The mayor has to sign that one.
but we can still put in for support even before he signs. That's really when it, could have more compilation of data concerning sickle cell disease and dissemination of data.
You want me to read it, but yet we don't have time.
No,
They have data, they have a ton of data on.
No, I think she's talking about the actual one. Just give the data, the one, so we know which one. The one I printed out was January 2023, but the more recent one that Hope signed, what's the date on that?
December 8th, 2023.
December, yeah. I thought one of them had passed, but New York City Council has passed its resolution. So in a way, it doesn't matter if the mayor has signed it, but they have passed it, so we're supporting both bills. And we're urging signing by the mayor on the New York City Council one. That's where I would put if someone could put a motion before the floor.
So, I'm sorry, with this particular one, we are saying we want to support the signature of this one? This particular
The
one?
way I would word it, I think, is that we support the passage of the New York City Council resolutions supporting were research dissemination on sickle cell disease. So we're voting on supporting the passage. Because it did pass, I just don't know if it was signed. But the passage is key. Was New York City Council, that was December. What I read was also December for that passage.
This one is
For New York City Council, yes.
I mean,
And so with New York, and what I would say with New York State Senate is that we would laud the passage by the New York State Senate and applaud Governor Hochul on its signage. That's the way.
Can we do unanimous consent?
That sounds good to me, although I'm the one that worded it, but does that count as coming from me? Worded?
I mean,
We need a,
I would say I would motion for us to accept these resolutions as written.
Okay, it's been approved and seconded by Monica Dula. All those in favor?
Heather?
You said these, we're only talking about.
Yeah,
Well, actually,
one
there's
we
proposal.
don't, yeah,
So I was in
one,
New York City one, because this is what we're looking at now.
the passage of New York City Council.
Yeah.
That
that's
one
what I would put
passed.
forward.
But Clotilde the only thing, we don't have the copy of it. I thought when I copied
The
this
Senate?
one. The Senate one,
This is the one.
but it's January 2023. Oh, but wait a minute. You said are we sure it's the exact wording?
Well, it didn't pass when.
Well, she just read something and said it
This
passed
passed.
the
Not saying
Senate.
that one there's some things from last session that did not pass, so they brought it up in this session.
Okay, so we don't know if the New York State Senate passed.
She signed it.
She signed it into law. Okay, so the pass.
What's the date? Is he here? Can you email it to him and ask him to print it out real quick for us so we can come back to it? Hakil.
Did he leave?
No, I'm sitting here, I'm
No, he
doing.
wouldn't have left because he was locked up.
Just, maybe when he comes back in.
Here's some copies, yeah.
No, those are all January.
Right, that's this current one. We want to see if there's something more.
You have the
recent.
current one, Clotilde?
No, I don't have the current one.
Yeah, so, anyway, I was able to pull up the one from, supporting the passage of New York City Council intro, that's the one we just,
Yes.
voted to
So-
approve.
So we want.
And that was, but I don't have I saw December 2023.
New York State Senate.
Okay, let me just see if I can do this real quick. Do we have anybody online on?
New York City bills on sickness.
Let's see who's, we have Dr. Ronstrom, Yael. I'm sorry, you guys. Are you hearing us okay?
Yes, yes.
Okay.
Are they?
Dr. Ronstrom, do you have your computer near you?
Yeah, I'm on my computer. Why?
Do you mind looking up also to see if New York State passed the New York, Senate bill or, on sickle cell disease?
You mean just Googling it?
Just Google, right, New York State sickle cell disease 2024 legislation for 2024, New York State legislation.
Okay. Did New York State pass bill sickle cell legislation? Is there a number, a bill number or?
For New York, we want New York State.
It is.
Let's see what number, I don't know in the new session. I have the old session.
Saying that Pat, she signed it.
You sign it, it's passed, and it's passed in the day of.
Well, you have to speak up,
Yeah.
Tim.
Signed it.
Pass.
Yeah.
Okay, and what's the date? Do you have that?
Let's see, it says December 8th.
Okay, that's what she has, December 8, 2023.
Yeah,
What we don't have is a copy of it, so thank you, Dr. Armstrong. It is the same as Clotilde is saying, but we just don't have a copy of it. Can we go on some trust here? Because what I have a copy of is 2023, and I don't know how much that may have changed. So I don't know how blind we should go, but we could vote.
I mean, I opened it,
On
looks
it.
like the same thing that
Is
is
it-
printed
yeah.
out.
Listen,
I mean, I opened it.
so we're not going totally blind
No,
on
it
this.
looks like, I mean, it looks like it's the same thing. It's dated January 17, 2023.
Okay, yeah, this is what I printed out, it's just that I see 2023. So next time with our resolution, what we need to just have make sure that they're the actual copies. But I did print it, but it's just that,
It looks
you
like
know,
it is the correct one.
okay. So do we want to do unanimous consent on the New York State passage of the sickle cell law, which was amended from yeah, that's what happened. It was amended from January 2023 in support of sickle cell disease screening, detection, and what was the other word they used? Counseling and referral. All those in favor?
I would say aye.
Yeah,
I vote for those, you said there are amendments that were made to this bill.
it was,
They're all
yeah,
positive.
that's what it says here. This is January 17. It says Section 243 of the Public Health Law is amended by Chapter 523. That is amended by adding a new subdivision 6 to read as.
Mhm.
So, you know, and then it got signed by Governor Hochul, but it would be good to have that actual bill for the executive committee. And so, let me just see if I can, Clotilde, it would help a lot with all the work if you would just find that actual bill that was
Let's see, I'm
signed.
gonna find it because it's.
And then
after
email
the
it.
name of the lady that I met in Queens.
Yes, I see that she's with NISCA, the New York State Sickle Cell. And we can mention them as, you know, appreciation of their fighting for this as
And
well.
it's because of her that I was able to submit this.
Yes, yes.
I just found something online. I think it looks very much the same that you had it in your attachment, but I just put the link in the chat.
Oh, fantastic.
See if it's that's what you want.
I was gonna say,
Okay.
it looks the same.
Yeah, thank you, Dr. Russell and Monique, because Monique says it looks the same to you. You just emailed it to me. It hasn't come up yet. It hasn't come up yet, but we'll see. But bottom line is which means we support it, and it goes to the executive committee. So we have a couple of days to make sure we have, hopefully what you said is the exact, so we'll have that. And this one from New York City Council to present, and that's where it gets moved from executive to general board. So at least it has moved out of both have moved out of our committee. Okay, So thank you, Clotilde, for bringing that to our attention. And again, in the interest of time, Clotilde, well, we have a little committee and anyone could join. We welcome you. We want to try to do with the sickle cell, something similar forum.
Yeah.
Clotilde, researched June 19 as the,
The World Day.
world,
June 19th to take advantage
Yeah.
of June 19th
awareness
is the
day.
World Day for
For
sickle
sickle
cell.
cell.
So it's celebrated worldwide and we wanted to add more awareness for our constituents here to inform them and to do like,
How would
We
you,
could do,
how would you wanna do increase awareness?
well, I was thinking, and Clotilde could, add in.
so.
In the interest of time,
Yeah.
sickle
We
cell
wanted to
survivors.
give the floor to people who have been impacted by the disease, either as patients or as caregiver, and who live here, and we have a lot of them. We just, by discussing between us, we found out that almost every family has been impacted by the disease, but very few know about it. So this is what, to give the floor about the daily life and the challenges that they go to, and to let them know that there's resources available. We have Center of Excellence here, Columbia is here, Mount Sinai is here. We do not have a nonprofit. We don't have a support group in West Harlem because
We did have, and
we used to have, but we don't have
Not
anymore. So
now.
this is a way to reconsider. So, and then we will have several panelists. It should not last more than an hour. It's like.
well, no, we
meeting,
were,
like-
panelists, a couple of,
Yes, so one will talk about the status, where we are today. And then some other expert can talk about the gene therapy. People are more interested to know how they're gonna be funded. Because it comes with
It's
a
very
high cost, it's
expensive.
about 2,000, 3,000, I'm sorry, millions, 2 million, 3 millions.
yeah. Right now it's
Just for the
expensive
cure,
for
so
our
this is
families, and so we had to figure out, where fundraising might be.
Why can't Columbia, decide that that'll be something that they put all their millions, gazillions into? I mean, like I said, the problem is they don't do what they're supposed to do.
Well, let's see what, maybe that's one thing, but I do have someone with WPAT television, radio, and she has a television show who's willing to help get the word out on that. But
So the question is in terms of the format, June 19th is not that far away. Are we looking to do something in virtual, hybrid?
Yes, it's gonna be, so far, we're thinking about hybrid. So virtual for people who live here, and then the rest of people can attend.
where?
So where?
So we talk about 25 people, and we can have it in this room over there. If
Okay,
it's
the
like
conference room.
the conference room,
Yeah.
like 25 people. We thought one time, eventually, we think still brainstorming about maybe having it at the city college where we had our last meeting, because it's more intimate, but also we have the
Get
radio.
onto the campus.
We have,
Yeah, no, she said there was one of I like the city college
The
space.
city college.
Absolutely.
we have access to the radio, the campus radio.
Yes,
In order to.
And they have a nice studio. I don't know if they can hold 25, but they would help. But there are at least a couple of options. With WPAT would give us a wider
Columbia
audience.
University as well has a radio. We can.
Well,
That's our
we're dealing
radio
with the
station.
campuses, so we'll see.
Yes.
Well,
So it's set not to be
Wednesday.
really the 19 per se, but around that period of time.
Well, I mean, I guess one thing is to see who could give us the space. I mean, I guess we could we could reach out and know that this space is a default. But
Yeah.
reach out, see if we could go to City College and use the room that we at.
Just so
Access
you
to,
know, I did send a letter to, not a letter, an email to Victor and Youth. I have not heard from them
City College.
on that, in reference to City College asking for that space, but then, so much broke loose with, the protests. But I think we could still ask and see. So so there is a request for them. So it has to be followed up, and maybe, Clotilde, if you don't mind calling, Youth and Victor to follow up.
Okay.
Because I CC'd you on that, email. And then, the space at City College was really kind of intimate. And if we're talking about, and they have 4 big screens, but it doesn't have to be that. And like we're saying, in the interest of time and so much.
Right, I mean, we know
yeah,
we can do it here.
Right.
Yeah, I mean, if you wanted to do it as city, it's worth calling and seeing if it's an option. And if not, do it in a conference room, because like you said, we could do it hybrid. So we know we can get local people to come and access that space.
And then if it's covered by the radio too, then that means we're getting it out to the community.
Right.
I mean, that would be great.
Mhm.
And like I said, the school has a radio station, but who knows?
I also suggested, Manhattan, Network. Now they're on Manhattan Neighborhood Network. They're on the east side, but they have a studio and they have, space. which is up here, use their space, for their conference. And, I think, again, they could also broadcast it. So, but anyway, maybe that could be for a later time. I think right now radio would probably work. They would want their person, anchor to moderate it. That's okay too. Yeah.
Yeah, I don't know how those things work.
Yeah, I've had to use them a number of times.
I assume in their studio, which means having a panel discussion.
You don't have to be in their
Oh,
studio.
no?
You can call, it could be done by telephone or by Zoom, and they get the sound.
Okay.
And even, with WPAT, Audrey said is that they could, it could be generic, dropped in, so that if it's done by WHCR, it could also be done or picked up by WPAT, and they just drop in there where the WHCR commentator talks, they drop in their moderator.
Well, whatever.
So
we're gonna do, we're gonna
it's
do it quick.
workable. But if you get I did an email, if you get with locating, the place, because I'm gonna be look like I
I
work
would
on a
like
resident.
just to, yes, fine, I mean.
David would. I'm gonna say goodnight because I gotta go.
Oh, hold on, Liz. Okay, let's try to, okay, please hold. Wait, Liz, please, we, and thank you all for, cause we all have to wrap up. What was the last? And then the very last.
The resolution.
We have another reason.
Yeah, the one that, resolution to protect and respect the rights of protesters and residents in Community Board 9. I have to admit, Monica, let people know, I first got an email from you about the hassle that was horrific, that you went through. And Liz, there's some other neighbors, the people who really are dealing with it are on Convent Avenue and
Yes.
right in that facility.
Really?
When you're not living right there and experiencing it, you think it's like, oh, whatever, Even Black people with all of our experiences, if it's not right in the area, there's some of them are like the same way. Not all, just some. So they may not see the urgency, but it was immediately urgent to a lot of people. I think we when I said we, Edwin and I were talking about it, because it was so much, I was hearing sirens like crazy that one night. It was like crazy.
I was out there,
And-
my colleague got caught up in it, she got beaten.
Yeah, I mean, there's
Yeah.
some horrible things
And-
that are
and
happening.
I had other colleagues that were,
Hold on, Liz, we need to vote for this.
legal observing,
Wow.
no, what Eric Adams said and what happened are two very, very, very different things. I have some videos in case anybody wants to see. We
But here's-
also call into, question the integrity of the administrators from City University. It was peaceful. I was out there, what's his name? Stanley? What's his
Gleason?
name? The one that has all the Emmys, the award-winning
Oh,
documentary. He
yeah,
was out there.
Nelson.
He was out there on Sunday. I was out there on Saturday. I was out there on Friday. It was peaceful. What happened? There's just no words. There was a 72-year-old professor that was beaten badly.
Oh, wow.
And,
And she was just going to her, a building.
Wow. Yeah, so, I spoke to Edwin because I was so mad. I was out there and what we have to go through just to move around from all kinds of.
And it happens more in our area, because even around Columbia University,
not-
my
it's not
alma
like
mater,
that.
it
Right.
didn't,
Right.
it didn't
Right.
happen that same way. As a matter of fact, even when the police were called by the president of Columbia to go in, those neighbors were shouting, "Shame on you. We want to solve our own problems. Shame on you. Shame
No,
on
no,
you."
they were, and what people don't realize is that those interlopers, or whatever you wanna call them. The people that were arrested outside of the gates are largely from the neighborhood.
Well, see, and that's it. So here's how this resolution is framed. We're not getting into the political issues of it, because, for the resolution. We're dealing with process, protecting people, protecting our community. And basically, this is backed by the whole concept of community policing. That, everyone should stay calm as possible. But the police should be trained, and maybe they need to be retrained. But, tensions can run high, but there is a right to free speech. You may not like what's being said. We're not dealing with what's being said. We're like protecting the rights.
Yeah,
So-
and just so you know, the cops took all the student ID of the people before they put them on the bus.
They took the IDs. When I sat in on the uniform services meeting, I mean, that's one of the questions I asked the lieutenant. I asked two quick questions. One, how many did you identify being students versus non-students? I think the assumption was maybe because school was out, it might be non-students, but he referenced that the mayor made comments regarding the percentage. That was one thing. And then two, I also asked, well, how long, what is the strategy to remove the police in the barricades? And he said it was an active situation, and that it was, active, or what is the word, moving? I'm trying to think.
I'm gonna tell you, the sound was very bad,
Yeah.
that night.
Yeah, I'm sorry
Yes,
for that.
it was
Yeah.
very
No,
bad.
I
this
mean,
evening.
and our city too.
I asked him, and then I said,
Are you in favor of
and he
the
said
resolution?
basically that he
Just real
couldn't
quick,
say
are you
when it would end. So I'm like, people can't live under siege indefinitely. This is a community where people live, we live here. And yet you're saying that you can't tell us when this will end. I mean, that's as much as he said, and he couldn't conclude. So, I mean, to me, not being too far away, but still hearing that our fellow community board members are being, handled in such a terrible way, that's just not.
And these are just the ones that have access to reaching out to us. There are others, like we heard about the lady that you talked about. I found out about her maybe a couple of days after. I thought it was a man at first, but they're just Liz Waite. how's you pronounce her name?
Yeah, Vitekas?
Oh, I take us, she was very upset. She did several emails to us.
Yeah.
And basically it's not, here's the other thing too. We tend to be, Edwin and I, particularly Edwin, living in the community and in that immediate area, very passionate about a lot of things. So we took it as saying the entire community board, anybody could bring this resolution up. We
Right.
weren't thinking that it only belonged to one committee to bring up. And just so you as committee members know, and I don't think even Monica knows, but I think we looked at Monica's memo, at least by that Tuesday of last week. You had sent it, and I was like, oh, wow. But not really thinking, then Edwin happened to call and I said, and because he's right up there, we're like, what in the world is going on? And he said, this is awful. And he was even more passionate. Said, look, I'm gonna do a resolution on this because all of us, the entire community board, we gotta look out for our people regardless of what part of the community they're in. So we discussed it, he wrote most of it because he's brilliant with that. I added some stuff, but we always say we, because some of the stuff I'll do and then he'll do a lot. At any rate, so I said, well, we gotta get this out real quick. So basically, I emailed it to all the co-chairs, because I didn't favor any committee. I felt this was something we all could look at, and the executive committee was meeting the next week. And when was it? And then uniform services was meeting that very next day, that Thursday.
Right.
So I said, this is great because they usually want to, if it has something dealing with a uniformed officer, they want to know. So it just worked out that way, and we were there, but the chair did feel that there should be
item number 10 and 11.
Priority
But,
of
Heather,
her
you asked a
committee.
question?
Yeah, let me ask a question.
Sorry,
about
Heather
item
is
number
asking a
10
question.
and 11. For item number 10, I need to just.
I was gonna go. We can't really hear you. Right, we can't hear Heather. It's Heather, so you want to step over here.
Suggesting in item number 10 that it be managed through the 311 process.
That could be discussed. So give us a suggestion on how you think that could be, because there needs to be a hotline. It can't be with us. Maybe there should be something related to police. I just thought about that now, like 988 is for mental health. Maybe because there's so many police issues that pop up, but I don't know.
11, we already have that in terms of the community council meetings and the NCO sector meetings, so I'm just.
Okay, probably then advocates for collaboration. Yeah, that's already established. Would you suggest wording it another way? So just go and give a suggestion. Advocates for collaboration.
We already have that.
You said it, so let's just give a suggestion on what, should we say? We have, should we just mention what that organization, that's Joyce, the committee Joyce belongs to,
I think Joyce
right?
sits on that, right? She has.
Okay, so we could say,
President of the community council for the
Right.
30th precinct.
and are there, okay, so we need both of them.
That's a cheerleading squad.
And then there's also, the NCO.
Oh, okay, so,
The NCO sector meetings, that's all precincts across, they have regular NCO, that's the neighborhood,
can you send that in a email to me real quick then, Heather? Just naming those, because we could add it in. Because we're not trying to, this is not anything anti-police, because we all need them, but because we do need them, we need to also be able to say. Exactly, exactly, we don't need them to halfway kill us.
You said halfway, oh my God.
That was one of Monica's words, or just be unsavory toward us at all levels, because the captain can come in or the sergeant can come in and they talk real nice, they know the lingo, the language. But when you're dealing with the one on the beat or whatever level they are, that's when it becomes.
People get beat up.
Yeah, it's like, it's the uniform becomes more important.
Well, it shouldn't. It's courtesy that's important.
So just give the organizations, Heather, and
I
organizing
mean,
community
it
meetings.
was
that
more
address
intense
residents'
at City College in terms of.
No, their reaction at City College was way more aggressive.
And we did.
No, that's what I meant. I'm saying.
Oh, the police report.
It's
Okay, so real quick, before Liz leaves,
Yeah, I got your word
do
too,
you
boy. I'm
agree
sorry.
to
Yeah.
going,
Yeah.
moving, because you all have read it and we know the circumstances. Heather wants to add some of the other organizations, and Heather, you can just even recommend a change, because the email was sent out to everybody, just recommend a change. We do resolutions, but we're not trying to be.
I'm just asking that you can strike that paragraph.
She said.
We might need to give recognition to them, though. We might need to give recognition so that there's more than one channel of communication. The communication channels need to be open with these protests.
Right now there should be. We do. There is.
Coordinating officers, the NCOs, there's a neighborhood
I put two of them down.
officer sector meetings, and then there's the community council meeting. And
No.
then there's this other organization that
We-
we have for oversight of police officers.
No, we have, it's called CCRB.
Let me write it.
That's it.
CCRB. You know, the mayor cut that budget, right?
Oh, my goodness.
Any five to hand, cause you're right, they're more Westford City. No, I mean,
I went to
you
city.
see
I know.
this.
You
Because
see-
they
you
equated
see-
with the community,
No, I'm looking.
people of color.
No, I'm looking at it. No, I'm. looking
Yeah,
at it.
in our
See?
community.
You're looking at it.
But anyway, right now, are you all at least in favor of moving it to the executive committee? And in between now and
This
Wednesday, please just give me the
Wednesday, all right.
information. Because we've heard too much from our community. We gotta act, or else people won't have
So,
any respect for the.
so Heather is suggesting we strike 11, because that is already in place. But then the thought is that we're not getting enough
We're not
engagement
connected.
from that.
Add those
Yeah, we-
organizations, but I'm saying that's what those organizations are here for.
Let's encourage a collaboration, maybe a task force collaboration, but somewhere, we don't have to have all that answer.
Well,
Regular community
I mean-
meetings, we have those all the time.
I mean, assuming Joyce saw this, then Joyce should be able to maybe weigh in and say.
Let
In
me put
terms of
Joyce's
that,
name down.
yeah, and say in terms of number 11 that Heather is referring to, this has already happened, but see if she can add something to make that a little bit more hefty. And then
Mhm.
Monica. you
I'll
were
have to
saying
call
something.
Monica because I won't hear from Monica otherwise. Monica, I will call you and just get your points that are missing, okay?
Yeah. And then the hotline, so then
I think the hotline is really
the
key.
gentleman that spoke, Darren, was it Darren?
Darren Yoke, Hope.
But,
rather.
okay, but the hotline number is for mental health, which I'm.
You know what? I don't mind the 311. They'll be getting a lot of calls, but 311 is set up where they can do data.
They're not gonna take, I mean, if you really wanna jam them up, you can call internal affairs.
Yeah.
So, say and call internal affairs.
Right, now all of that's recorded. Every time they get a call, that's recorded.
Yeah, okay. Internal affairs.
There's a
Internal
number
affairs of
for,
our
if you
precinct?
call 311 and you say,
Right.
I need internal affairs,
For
they will
police.
transfer you, yes.
And they will transfer.
Yes, they
Okay.
will.
So then.
Then that makes a lot of sense.
So then
And
it's
people
just,
need to do it.
right, so is that the suggestion that something
Yes.
like that is
Mhm.
added
Yes.
to this?
Call
It needs to be
311
Instead of the
request-
hotline?
Request internal
More
affairs.
specific is all I'm saying.
Okay, Heather.
That's it.
But we asked people to make their comments, so we would have it, so that's,
what these meetings are for. I don't have a lot of time outside of these.
no,
meetings.
just to shoot a,
Well, no one
email
has a
note.
lot of time. have they?
Yeah.
Be more
So,
specific.
I run basically 2 other committees.
Call
Me and my-
311.
But this way we get it right,
Right, so we can move it forward.
and so we
And
can move it
request,
forward,
They're not
yeah.
gonna, boy, they're not gonna like that, but that's good.
Internal affairs, the police never like to think that they really are public servants for
I-
people.
Well, of course, that's why we have a mayor who thinks he's Jesus.
Yeah,
Mhm.
but the other thing though, like I said, asking Joyce about her work on.
Yeah, I
the
have
council.
Joyce's name
And see,
here.
cause they do have, she does work with the local precinct, so, the
Yeah,
goal
I'll
is
ask
to
her.
maybe do a two-way approach. try to see how we can strengthen the relationships with
Yeah.
those community-based officers who want to be engaged and do the right thing.
Yeah, something has to really reach the ones on the street. That's where the real, well, their
Oh, that's
problem could be at the top,
But let me
but
tell you about
also the
what
problem
one
with
of
the
those
police.
cops told my colleague who was legal observing. Oh, so you using people as a human shield now, huh?
Who said
Before
that?
The cop, before he decided to bust the old lady.
Oh,
wow.
Well, Monica,
I-
share
I-
that video with me.
Hold
you know-
on now.
you know
Amber, talk
something-
real quick, 'cause people-
You
talk
know
real quick.
something that I think
He's
we
still
had
there.
the meeting with the Uniform and Services Committee.
Yes, I
And
mentioned that.
and in that meeting, you basically had the non-decision makers as to what was happening here, of what is happening here right now, because the representative from the 2-6 and the 3-0, they basically said they have no control over this. What is community policing if you have folks who can make no decision on an intrusion in our community? What kind of
Edwin, he command.
to rise up and hold them accountable, right? Because those of us living here are the one dealing with this type of, stress, because these cops that are there, they're from all over the place. I saw a guy from the 44 precinct, who is raining. He's under the scaffolding. They're blocking the sidewalk. I'm walking with my daughter, and I'm asking him, can you just open that space? And the guy was like, no, you got to walk to the middle of the street while it's raining. Many folks in the community board, they have not walked around that perimeter of Amsterdam and Convent. And I think that people should so they can see what is it that we're talking about.
I think
Today
the
is a-
people who are here have, in
No,
this
I
committee.
know, the people
So we
here,
need
they
to
have,
say that executive.
no, the
we
people
need-
here, I'm speaking of, in general, not the people who have attended, but if people are gonna be speaking about this issue, they should experience, at least at a bare minimum, the experience that folks here are dealing with. Because
Yeah.
today is 139, 140, 141st, 135th. Tomorrow, it could be any of our neighborhood.
And it
it's-
has happened before.
Yeah,
Militarized zones, they're talking about it all over the country, they become military. So
And then-
Evan, we gotta leave because the,
Okay.
how kills. Okay, but right now they are.
But real
approving-
quick,
Uh-huh.
Laquita, the question for us here is, how did Brown fix this? And our local universities, they didn't do the same.
And that's one of the things, maybe that could be something, we gotta look at ways in which protesters we don't need NYPD, so
Yeah.
we need them, but maybe not in this area, but, everyone has agreed, I'm gonna call Monica. Monique has made some suggestions, Monique, I'll probably have to call everybody here, but are you generally in favor of at least this moving to executive? It's got to,
Oh,
that's
yeah.
how, 'cause
Yes.
people looking at that chat, we would be. I don't know, it's very irresponsible if we don't make some kind of statement.
No, wait, are you looking to present it to the
Executive this
I'm getting
Thursday.
feedback from everybody that, like, those, like, the
Well,
committee.
this committee.
And we have sent those emails asking for people feedback over and over.
No, I understand, but did you hear back from anybody?
Liz, well,
Only from
actually,
Liz.
yes, Liz and Tina thought it was great. She's only one co-chair, arts and culture, but I could ask Walter. I may just have to call them again, because most of them we have good relationships.
But Walter is not even living in the community.
Might be uniform services.
Walter what?
He's not even in the community.
Walter, oh no, now this is not for walking around, he's co-chair, I'm talking about calling the committee co-chairs for their
Oh.
feedback on the resolution.
Right,
Yeah, that wall.
right. I mean, you put it out there, we wanna make sure Carolyn said no, weigh in.
Well,
So,
Carolyn was concerned that it should come to her committee first, but essentially it did come to her committee first.
yeah, she
Indeed.
pooped it.
And she did,
It
yeah,
did.
she didn't want it herself.
Yeah, 'cause she
But
other
the thing
times,
about
it's okay.
all committee chairs is that we represent a big committee, so
Yeah.
one person's voice matters, it matters. But who are the other voices that we need to hear from? So, anyway, I hope she, understands, because I did try to explain it as, this happened so quickly. And, to wait, we shouldn't have to wait a month for something to go before
No,
one committee.
No, I agree. I mean, this
so
issue is
it was
hot
done the right
and-
way.
And it's happening. Follow up so that when this, to see when you bring it, you have as much feedback from the different committees as possible. You said Carolyn got back.
She wrote back,
She doesn't agree with it.
contacted her by email. Her main thing was, I don't agree with students damaging property, but nobody said that this doesn't
Address that.
this doesn't approve. Well, but that was her response.
But I'm saying she been brainwashed.
Well, that was it was a written response, so I'm not making.
Right, so if that's not.
Thank you all.
Thank
Bye
you, everyone.
bye.
So we can, that could be countered during a discussion.
Yeah,
Yeah,
but I think that, if she hasn't been around that perimeter without folks knowing who she is, I think that the experience that she has is very different than those who live here. And this is something for the entire board to look into. The community is waiting for everyone,
and that's those two communities, it's really two communities. We're talking about CCNY, but Columbia's ours too.
Correct.
And it's
Yes,
interesting
ma'am.
because they're two totally
And
different
the
kinds of communities.
responses that were witnessed in these two at these two institutions, which are in our community board, are real. And, we're right in the middle of.
Yeah, so the main,
Of it,
exactly, there are
And
communities.
it's still
so
ongoing right now.
right.
And we
It's
have to be
basic-
concerned.
Yeah. And then the
Maybe-
city cannot say on one end, we have no money, and then you see a massive display of police officers 24/7 just blocking the street on their cell phones, waiting for something to happen.
And that's what it seems like is happening now at CCNY, because there's not like violence, but people are still being blocked from going into their
Yes,
homes.
ma'am. Yes, ma'am.
And it's just what's
And
been saying,
harassed.
it is a militarized zone. So, all right, Edwin, we're gonna,
Right.
and
Sounds
Yael is on, and so, Hakil, is ready to leave, we all are. And like always, we do have good discussions, so, thank you, everybody.
Thank you. Thank you,
Edwin,
everyone.
I'll follow up with you on the rezos.
Okay. Please,
All
yeah.
righty, thank
All right.
you.
Take care.
Peace out,
Bye-bye.
as they say. Bye-bye. Let's see.